Hi everyone, Nurse Nilla here. We're going to cover how to properly wear face mask or face covering. Looking at the various type of mask, you can check out the previous video. Surgical, cloth mask, and N95. Surgical and cloth mask, practically the same way to wear them. N95, yes, you have a step or two in addition. We're going to cover the most common type of mask first and how to effectively put on your mask. The mask in itself is not a fashion wear. Yes, we can try to do all of that, which is okay. But remember, the purpose for the mask is protection. Protection for you, your loved ones, and the community from all those respiratory infectious diseases. Whatever mask you are wearing should provide you full coverage from the crown of your nose to your jawline. Okay? In this manner, your nose bridge to your jawline should be covered. The surgical mask. You want to take a look at the accordion style because you will need to spread that out. Start with one earlobe, put that in and stretch it. And then put out the second loop in your other earlobe and adjust to fit comfortably. The bottom rim, pull that so it is under your jawline. Okay? Notice the side, you have a seal right here. And on this end, you do have a seal or a very good fitting. Most importantly, your nose bridge. Remember, you do have a flexible rod and that needs to compress that so it can conform. Just press on it gently so it can conform to your nose bridge. And you can always adjust it by pulling on it and then compress. So it kind of falls down and then conform to your facial structure. So this is the effective way to put on your mask so that when you are talking, you can talk without the mask falling off your face. You can move your head sideways, up and down, and the mask is securely in place. Let's move on to our next mask. It's the same way you put this on. The same way, it is the same way to put on your surgical mask and your cloth mask. Now, we're going to cover the N95. Taking this off, again, you start from one earlobe and take it off from the other. So when you remove your mask, you want to fold it inwards because your breath has made contact. So from your breath, any form of microbes would have been on the contact surface of the interior material. So folding it inwards is the recommended way. So you are touching the exterior and not the interior surface. Next in line is N95. N95 is actually a professional mask. This you will find in most health environments where there is a high rate of exposure to microbes. So what is the recommended way to wear this? First, you have to be professionally fitted to wear the N95 mask because we all have different facial structures. So one size does not fit all. How often should you be fitted for it? Is it every year? Is it every time you need to put it on? Not necessarily. But the rule of thumb is, if you have lost any significant weight within any time frame, which could be any number of weeks, months, once you have a reduction in your size, you have to be refitted for the N95 mask. If you are maintaining the same size, it is generally recommended be fitted annually. Let's move on to how to properly wear this. Because sometimes, as a health educator, I have noticed that some people do struggle with this, or they put it on without actually achieving the highest efficacy of the N95. The N95 is designed to give you a proper seal, preventing any intrusion of microbes into your air, so that when you are inhaling the air is clean. You could be in a highly infested environment without inhaling in any of the microbes if you are using this correctly. So you want to hold it at the front in this manner and position it in your jaw. Hold this the top loop. So you have this at the crown of your head. You see that? Then you want to pick on the bottom loop while you are holding down your mask. Raise that up, and that is actually going to the back of your head. Okay, you can see that. Okay, from the front all the way to the back. And once you put it on, yes, it can be very uncomfortable. So imagine healthcare workers that have to put on this and have it on for 8, 12, 16 hours. Wow, it is a tough one, but it is a necessity. The last thing you want to do once you have this on, you want to gently compress the flexible rod against your nose bridge and make sure everything lays flat. If you can see my jawline, it actually expands beyond my jawline to give me a coverage at the bottom. You don't want an N95 that hangs before your jawline. That is not a proper fitting. The last thing you do when you put on an N95 is to check for proper seal. That you can actually do by yourself. What you need to do is place your hands on top in this manner and exhale. If you can feel your warm breath against the palm of your hand, that means you do not have a good coverage. So you need to real seal again. So let's perform that simple test together. Your hands on top, exhale. I feel nothing, absolutely nothing. So that tells me I have 100% coverage. So that is why N95 is recommended when you have high exposure rates. How do you take off your N95? It is simple. So you want to, you want to start from the bottom. Start from the bottom. Remember, when you put it on, you start from the top, right? The top loop. Taking it off, you start from the bottom loop. And you remove that. And away from you, do not touch the inner surface. Hold it hope you have benefited from this information today as we all do our parts to keep ourselves and our community safe.